Today's video is based on one of my on-call shifts where I was asked to see a patient that had literally this much urine in their bladder, and despite trying to pee so many times, they literally couldn't empty anything out. And I was asked by the nurses to essentially see them and make them feel better. And before you cringe, I promise that this is not urine. It's just water and some orange juice that I found in my fridge, which I've mixed together to recreate just how much urine was in this individual's bladder, as I talk to you guys today about a condition called urinary retention. Hello everyone, my name is Dr. Uyiosa, and this channel is about all things health, business and finance. My goal is for us to get healthy together whilst making better money and business decisions. So you're probably thinking, what is urinary retention? Can it happen to me? How do you get it? What happens if you do have it? Well, I'm going to answer every single one of your questions, but before I do, I want us to have a really quick recap of how the kidneys, the bladder, all work in helping us get urine out of our body. So we're going to start from the top and then work our way down. So at the top, we've got the kidneys, and the kidneys are amazing because they remove toxins from our blood. And then coming off the kidneys are tubes known as the urethra, and they take the urine produced by the kidneys to the bladder for the bladder to store it. And then from the bladder, we have another tube known as the urethra, and that tube helps to expel urine out of our body. The first cause of urinary retention is blockage to the urethra, and this could be due to prostate cancer, prostate enlargement, or narrowing of the urethra itself due to trauma or infection. The second is a side effect of certain medications such as antimuscarinics, which work by blocking the cholinergic receptors in our body. The third is post-operative side effects as a result of the anaesthetic that is used. The fourth cause is postpartum. In the first few days after childbirth, some women may find it difficult to fully empty their bladder, and in about 1 in 500 women will experience this lasting longer than 3 days. And there are so many different reasons as to why this is. It could be as a result of pain in the vulva/perineum area. Another cause could be a side effect of the spinal anaesthetic or epidural that was used during childbirth. And the third could be as a result of damage to the nerve supply in the pelvis during the actual childbirth itself. The fifth cause is constipation. If your bowel is full of poo, then it can press on the bladder and the urethra. The last, but not the least, is neurogenic causes. And this is when the nerves supplying the bladder and the urethra don't work as they should, and therefore the muscles associated with these areas are either underactive or overactive. And this can be seen in conditions such as diabetes, stroke, in brain injuries, in spinal cord injuries, and many more conditions. There are two types of urinary retention to be aware of. The first is acute, and this is a surgical emergency, and it's when the individual has not been able to pass urine over a few hours. And the second type is chronic urinary retention, and this can happen over months to years, and is when an individual cannot fully empty their bladder. And so the amount of urine left, which is known as the residual volume, is more than 1 litre. The treatment of urinary retention is identifying the cause of it in the first place. But in an acute setting, you would insert a catheter to empty the bladder and make the patient feel more comfortable.